take you through some questions for the MRCP Part 1 on infectious diseases and also respiratory medicine. So in terms of an overview, this section is not always easy, but if you revise well and really concentrate on some of the infections that appear to come up repeatedly in the MRCP, then you can actually do better than others who take the same exam. You have to be quite clever about answering questions, as often they will pose infectious diseases that you have never heard of, and you'll come across a few like that, as I have in the questions that follow, and they try and throw you. In these cases, what you need to do is rule out the ones that you know, and by elimination you may be able to figure out the correct answer, or at least narrow it down to maybe 2, so it gives you only a 50-50 chance of getting it right rather than a 20% chance. However, I will take you through some of the more common infections which do come up, some of which are common and you'll have seen and you have treated these patients, but there will be others which commonly come up in the MRCP exam because of their characteristic presentations. You also need to know about drugs, so namely antibiotics to treat infections, how to diagnose these infections, and read up on things like HIV, TB, vaccines, and infections like listeriosis, salmonella, varicella zoster, hepatitis, HSV. But I'll take you through some questions now to give you an idea of how to tackle these. So a 56-year-old male with diabetes and end-stage renal failure was on 3 times a week hemodialysis for the past 6 months. He recently underwent a renal transplant and was well for the first 2 weeks. He then started to develop shortness of breath, fever and some mild confusion. His inpatient bed was in close proximity to construction work, which was being carried out on the other side of the road next to the hospital. Which of the following organisms is likely to have caused an infection which led to the present condition? So we have A, Escherichia coli, B, Blastomyces dermatitis, C, Aspergillus fumigatus, D, Coccidioides immitis, and E, Mycobacterium tuberculosis. So hopefully this is an easy start. The answer is C, Aspergillus fumigatus. The patient has acquired this fungal infection, which is the causative organism responsible for aspergillosis. Now, aspergillosis conidia spores are ubiquitous in the environment, and therefore they're unavoidable. And after inhalation of airborne fungal conidia, clinical manifestations of the disease are largely dependent on the host immune response. An increased risk of aspergillosis has been recognised in patients who have gone hematopoietic cell transplantation, particularly in the early phase when they're neutropenic, and during treatment of graft versus host disease, and among solid organ transplant recipients like this 56-year-old male treated with immunosuppressants, glucocorticoids and other immunosuppressive agents. Now this organism is found in decaying organic matter and also soil. So if you look at the question and the clues, we've got renal transplant, and then we've got proximity to construction work. And these are a source of the aspergillus through the release of dust and spores during the building work. And once the diagnosis has been made, management includes, if possible, to reduce the dose of immunosuppression, but also use antifungals like voriconazole. Looking at the others, E. coli, as you're aware, that's gastrointestinal urinary tract infections. Blastomyces dermatitis, that leads to blastomycosis, found in America, Canada. Typically though, that's around lakes and rivers, so water, and that's characterized similarly with fever, but also cough, muscle aches, joint pain. Coccidioides immitis is a fungus found in the soil, again in America, but also I think low down in Mexico, leading to coccidioidomycosis, also known as valley fever, and that presents with a generalized rash and flu-like symptoms. And then lastly, Mycobacterium tuberculosis. I mean, it's unlikely an infection like TB will develop in such a short time frame, and you would have thought in someone who has had renal transplant that they would have assessed for the presence of active TB or latent TB prior to the renal transplantation.